Good morning. I'm Bill Patten, Interim CEO here at Rehoboth McKinley Christian Hospital. I want to give you a report from the regular board meeting that was held on February 28th. Prior to the board meeting, the board got together and discussed our foundation, or what had been our foundation. The board is very interested in reconstituting, bringing back to life the foundation. And so they talked about the bylaws, they talked about potential events that we would want the foundation to perform, and they talked about staffing for the foundation. I'm excited to see this step forward. I think it's a very positive step by the board. The foundation is important for fundraising, but it's also important to connect with the community in very positive ways. At the beginning of the board meeting, the board heard reports from the Board Quality Committee, the Board Finance Committee, the Medical Executive Committee, and the Credentials Committee of the medical staff. All of these are important committees and ways that the board does work beyond just the time that it spends in its meetings. The board also had a report from the Human Resources Department. It's important that you know that Human Resources is actively monitoring the morale and well-being of our employees. We recently completed an employee satisfaction survey, the first one we had done in years. Numbers came back far more positive than would have been expected, given the challenges that we faced financially, as well as the many issues we faced during the pandemic. But we're building on the suggestions that were given to us in the survey. One of them, the same topic that we heard from the county, was that we need to do a better job communicating. And so we've done a series of all staff meetings. We actually have another one scheduled for next week, where I meet 4 different sessions and go through an update on all the different issues that are going on at the hospital and give the employees an opportunity to ask me questions directly. Now, the sessions have been well attended, and I'm looking forward to next week's meeting because I'm going to be able to give them a very positive update from the results of the most recent legislative session, the hard work that our legislators did on our behalf, that the governor signed into law just yesterday. So we're looking forward to that. By way of finances, just to give you a brief summary as far as the financial situation here at the hospital from the Finance Committee. We have our finances reported through December of 2023. So fiscal year 2023, we had end of year numbers. And December was a low volume month. We didn't have, either on the inpatient side or the outpatient side, the amount of volume that we had projected in our budget. So our revenues, both gross revenues and net revenues, were significantly below the budget. Our expenses also were below budget, and we ended the month with a loss of about $1.3 million. But you need to keep in mind that that does not include the $750,000 of payroll support that we received from the county in December. We're waiting to hear from our auditors where they want us to book that money on our financial statements so that we can both be in compliance from an audit perspective, but we can also optimize the reimbursement that we get under the critical access program. So if you add the $750,000, then the loss was around $600,000. Still not a good number, but much better than the numbers that we've been seeing the previous months. As far as progress on paying our bills, something that a lot of people are talking about, happy to report that significant progress is being made there. In October, we had accounts payable that totaled about $33.5 million. By November, we had reduced that not quite $2 million. And in December, we had reduced it almost another $2 million, $1.8 million. 750 of that was from the support that we got from the county, but on our own, we still reduced our accounts payable, what we owe our vendors, by over $1 million. So we're making significant progress. And once we get the final tally from House Bill 2 that the governor signed yesterday, we'll be able to share more good news and the plans for how we're going to continue to get caught up on paying our bills. In my report to the board, I updated them on a number of medical staff related topics. I was happy to report that we have completed our negotiations with High Desert Physician Management, our physician hospitalist group. That contract took effect the 1st of March. Was unhappy to report that we've had a couple of physicians give us their notice. Dr. Spiva has decided that he's going to move over to GIMC, and Dr. Schaefer and his wife Jennifer are going to be joining Navajo Clinic south of Gallup. So we'll be looking to replace those important physicians. Also, we're actively pursuing physicians to replace Dr. Shimoski. Dr. Shimoski decided that he wanted to head in a different direction, and so we're looking for another physician to lead our sleep lab program. We're actively recruiting cardiologists. We actually are signing with a new kind of recruiting company so that we can get cardiology back on board full-time. We're looking for 5-day-a-week coverage. We're also looking to add a new service, talking with a physician to do cataract surgery here at Rehoboth. So excited about that. And then we're making plans to celebrate National Doctors Day. In the past couple of years, we haven't spent a lot of time or energy on that because of our financial situation. I've decided finances or not, we need to say thank you to our physicians. So we're planning a luncheon for all of the physicians, not just the hospital-based ones, but all the community physicians, so that we can say thank you and express our appreciation for the great work that they do providing high-quality patient care here in Gallup. On the operations front, I informed the board that the county has appointed a new member to the board. We're looking forward to receiving the file on that individual, orienting them and welcoming them to the hospital board. Also updated the board. You may have heard about this hack, this breach that happened. Company back east. It's called a clearinghouse. It's where hospitals send their bills, and then this company processes them and sends them out to all the different insurance companies. Fortunately, we don't use that clearinghouse, but some of our insurance companies do. So the impact to us is minimal compared to some of the other hospitals, but we are closely monitoring it and making sure that we don't have a disruption in our day-to-day cash flow. I'm working to get the board a list of companies that perform facility master planning. We have been talking with the county about a number of important projects regarding upgrades to our physical plant. I want to make sure that we don't miss anything, and I want to make sure that we have the projects phased properly. So I would like to do a full-blown facility master plan. We haven't done one of those in many years. So I'm going to give the board options to do that. We're exploring options to bring biomedical services back. Again, because of finances, we had ended those services. Can't have that for very long, so we've got some good options. I hope to have that in place by the end of March or early in April. We're also looking at hiring some of those flex RNs that I talked about. At our meeting last month, the board had approved that. We're making progress on our efforts to combine the med-surg unit and the ICU. We'll now call it the ACU, Advanced Care Unit. That will allow us to be more effective in our staffing. We have seen higher patient volumes. Our goal is to be able to have as many as 22 inpatients. And then I updated the board on efforts that CHC has underway for a volume reduction adjustment payment. Medicare has a program where if you have a significant change in your volumes, you actually can submit a request and get reimbursed for part of the revenue that you missed. We certainly qualify for that from last year. And so in partnership with CHC, we're working to make a submission and hopefully get some money for that. Board went into executive session to discuss a number of confidential issues, but after they came out of executive session, they directed me on two different fronts. One, to continue my efforts to hire a chief operating officer. This position is being looked at as the heir apparent for a new CEO role, so that when I finish my assignment here, we'll have someone that we can very easily move into the CEO position. The board also directed me to identify consulting companies, including CHC, that we can get proposals from for when the contract that we have with CHC ends. So I'm supposed to be giving the board options. There are a number of companies out there that I'll be looking at and giving proposals to the board so that over the next month or two, they'll be able to make a decision. We also have been in conversations with health systems within the state to see if there's an interest in partnering with us. And we also know that working with the county will be an important part of our future moving forward. Hope you find this update helpful. As always, give me a call if I can provide further information. Thank you.